We have coronavirus team coverage tonight live at 5. We're taking you through the process local hospitals are going through right now, trying to create additional ICU capacity.
We begin tonight with News Channel 3's Shelby Nelson, who is live for us at a testing site in Palm Springs with more on how to avert a potential crisis. Shelby.
Well, Karen, right now in Riverside County, hospitalizations are higher than they have ever been during the pandemic. Health experts say we are well into the Thanksgiving surge, and with Christmas and New Year's right around the corner, those numbers could get even worse.
Yeah, the numbers not looking so good, and we expect them to continue at this point.
Hospitalizations in Riverside County now worse than ever before.
If the current trend continues, we expect to have between 1,800 and 2,200 COVID hospitalizations by this time next month. We are worried that a continued rise in cases at this rate will be unsustainable.
This message from Dr. Jeffrey Leung last Friday, one of the first days the Pfizer vaccine was administered in the county.
The vaccine is going to be great. It is a great thing, a great tool that we have, but it's a tool that's still in progress and it hasn't been fully implemented.
County spokesperson Jose Arbayo says hospitals are right in the middle of the Thanksgiving surge. Back-to-back holidays are posing an even greater risk, with 5.7 million people expected to travel in Southern California in the coming days. Appointments at county testing sites are also experiencing delays.
We're having the same kind of push we had just before Thanksgiving. People want to get tested, presumably in many cases because they want to take the test before they meet up with their family, which is exactly what we don't want them to do.
If we do behave that way, then we are going to get into numbers that indeed are not sustainable.
Eisenhower Health Chief Medical Officer Dr. Alan Williamson says right now they're having to refine their surge plan.
Unfortunately, the ICU is also full. We've had to displace some of our other surgical cases and so on, kind of consolidate those all into one unit so that we can have 3 of our 4 intensive care units that are dedicated almost exclusively to COVID right now.
As the hospital prepares, that means having to postpone more elective surgeries.
This is a very significant surge, much bigger than what we saw after Memorial Day.
With more holidays in sight, health experts are urging people to limit gatherings to avoid one surge on top of the other.
What can we do to try to avoid that? The answer is obvious. If we could truncate the Thanksgiving surge and just allow that to come back down, then we would all be able to meet those needs for our community.
Now, surge plans do account for patients that are not in the hospital related to COVID, but in any case, lowering those numbers and having an adequate amount of staff means taking care of patients at a higher level of care. In Palm Springs, I'm Shelby Nelson, News Channel 3.